Okay, thank you so much. And we are back. We have Nurse Frida and Dr. Anton getting the patient ready, as you can see here. So what are you looking for? Can you tell us what we're doing?
Yeah, we're going to start with, I usually start below the knee on each side, below knee, above knee, below knee, above knee. And I'll wrap with this Coban material. It's a pressure wrap as I go along. I put this on, and it will remain on for either 2 hours or overnight, depending on the size of the vein. But they have unlimited activity today. She can do whatever she wants. I wouldn't advise running or exercising. But tomorrow morning, she can unwrap these, and she can exercise. She can do unlimited activity tomorrow. This takes the place of these stockings, the compression hose. You only need this on for a few hours or overnight.
Sure.
Uh,
And with
okay.
these on, they're able to do activities
Yeah,
the day
you'll see
of.
it's nice and stretchy. It's comfortable very well.
Sure.
And you don't have to pay for a pair of stockings.
Great. All right.
So to do this, you have to wear magnification glasses so it magnifies. So we'll start down by the ankles. This is a very common area. Obviously, it's farther down. There's more gravity, so it's very common down here. And what I simply do is, I'm going to have you roll on your right side a bit. She'll just roll over on her right side. Here we go. And this will give you a nice view. And the object is to get the needle into the vein. If you can't get the needle in the vein, and that is the rate limiting step, two things happen. Number one, it simply won't work. And number two, you can damage the skin around it. So the side effects from some of this are discoloration, or you can actually get little holes or ulcers in the skin if you're not careful, depending on the type of solution. This happens to be a detergent type solution. And it's a tiny needle, the smallest needle they make. It's a 30 gauge needle. And I'll just show you right here. This would be an example of one. And you can see the solution disperse sclerotherapy versus some people kind of damages the skin and is almost painless because it's so small. The solution is painless also. So you can that's what you want to see.
Wow.
Let's bring that just like that.
And since the needle is the tiniest needle you can find, you don't need
you
a
have to
numbing
be real
agent
gentle.
or
You can
anything.
see all these veins disappearing. You know, if you're not in the vein right away, then just stop. You don't want to damage the skin.
Sure.
And we're just going to move around
Okay.
into other areas here.
Wow.
Yeah, you just have to be patient with it.
Yeah, precise work.
And you know, often the needle is larger than the vein size.
Right.
So we can actually
So these would be spider veins, not varicose veins.
yeah, now these little ones, you'll notice the color is different.
Yeah.
These the smaller they are, they appear to be magenta or red colored. And the bigger ones are blue, but you can see how this disperses out. And it's okay if the fluid comes out. You just don't want it to get trapped under the skin.
Okay.
So what I'm going to do is wrap this area. Just give me a minute, I'll show you what this looks like.
Now, are spider veins always visible?
Yeah, they have to be, otherwise you wouldn't.
They wouldn't be spider veins, right?
You wouldn't have them, yeah.
Right.
So this wrap is very convenient for them. It's flexible. They'll be able to bend the ankle joint or the knee joint. And all I'm doing is putting it on so it compresses the vein. You want the vein wall to scar down and stick so no blood gets into it. Then therefore you don't see it anymore. And by the way, if you select the proper veins and you inject them, they don't recur. You might get new ones, but in my experience, they will not come back.
Okay.
Let's look at some different veins. Let's look at some of these up here. And you see there's different color veins. You have these big blue veins, and then the darker magenta,
Sure, sure.
red colored veins. So let me show you what this looks like. The other thing you do is you frequently change the needles because they're very delicate and they get dull these, so they remain sharp. Dull needles are no fun for me. Oh, bend your knee and go just like that. And
Yeah.
I'm going to straighten this out here.
Wow.
It's pretty dramatic.
Wow.
And the point is, if you don't, you better go somewhere else.
Right. So this is instant.
This is
yes,
instant
yes.
gratification. What
Wow.
everybody. These veins are smaller than the actual needle tip, so you
Right.
have to be real careful. It's kind of like watching fireworks, you know, this
Yeah.
place, that whole area.
Yeah.
We're going to do some more here, so I'm going to have you roll on your tummy. There you go, just like that. So let's get a good shot of this stuff here. This will be a little dramatic here for you. Another alcohol. So now we're going to get some, if I can get in.
Trying to zoom in. Wow. This is amazing. Yeah, so you can just start from the bottom. It's like roots. It just spreads through the whole vein. Wow.
So it's kind of like, I'll have to reload here. Just give me a second. Hold some pressure
Sure.
there.
Now, is this more of a cosmetic issue, or would you say that is a part of a vein disease?
It's mostly cosmetic. Some people have painful, she may have some pain from these because they're being fed by some of these bigger veins here.
Okay.
So, I mean, they're considered cosmetic by most insurance companies,
Right.
whether they're painful or not. If they're,
Right.
if they're spider veins, they're not going to usually cover that type of procedure. So let's continue up here. She'll have a whole new, you know, she'll have a whole new set of wheels.
Yeah,
you know,
it really looks
in a
like
couple of months.
it's
And I
insane.
usually wait a month in between sessions, okay, because you want the skin to heal.
Okay.
And you have to be gentle with it. That what's called hemosiderin staining. So and you see, you rest your hands on the patient. You can't be wiggling around.
Sure.
And just be gentle with it. You can see some of the solution. These have lightened up already, but we're gonna just continue up.
Now, can these ever return, or is this a one-time procedure?
Like I said before, if you select them properly and you treat them properly, they don't recur.
Okay.
Now, what happens is 100% of these aren't going to be gone. You see how it's all, if you look at the leg, it's all red and inflamed?
Yeah,
That's why you put the compression on.
I see.
80% of this stuff will be gone just from today, but there'll be little remnants of them, which you'll get the next time. It's
Okay.
never a one and done.
Sure.
These veins have, but it's pretty dramatic. I mean, if you're
Yeah.
if you're good at it, you know the results you'll see right away.
And I have a feeling, I mean, the patient's not seeing this happen.
Um,
She's going to be stunned when she looks in the mirror.
do you find this
great.
painful?
Good.
On a scale of 1 to 10, 0 being no pain.
She said 1 or 2. Wow.
Okay.
Amazing.
So I'm going to wrap this area.
Okay.
You can see how it's all inflamed. That's it. This solution is intended to irritate the vein and cause it to scar and shut.
I see.
And we went through a whole nother syringe again, okay?
Okay.
So that's a whole vial of, it's about 2 milliliters, 2 mLs of solution.
Right.
So I'm going to have a roll on this side, and I'm going to wrap that thigh.
Okay. So every
depending-
section you're rolling it very tightly, correct?
No,
Oops.
not too bad.
Not too bad. Okay.
No, it's not. Oh, let me just wipe that.
And you mentioned this would not be covered by insurance, correct?
In general, spider veins are not covered by insurance. No, this is not terribly tight at all.
Okay.
In fact, it usually makes them feel more comfortable. It's a nice wrap,
Sure. Right.
so it won't impinge on their range of motion.
And then she'll be taking it off tonight, as you mentioned.
Either
So
before she goes to bed, or it depends on the size of the veins. The bigger veins need more compression time. So the tiny spider veins, they can take off in 2 to 3 hours. Sometimes they take it off when they go to bed, or people like to leave it on overnight. I mean, if you've had the
Right.
procedure, you might as well
Might as well
get the
just sleep with
maximum
it. Sure.
compression, right?
Sure. That makes sense.
So let's see what else we want to do.
Yeah. What's next?
Let's see on the back here. Tell you what we can do. I'm trying to get a good angle for you. Let's go back under your back. And then let's go on that side. This will be good. Yeah, we might as well continue. So
Yeah.
these are areas that are typically pretty common. And, we're going to get these dark ones today. At a later time, if you can see these blue
greenish,
ones, I'll come
yeah.
back and get those.
Okay.
But I'm going to go for the ones that are most dramatic today. But all of these are injectable, okay? So
Even the green veins that look
these little
more
these green ones,
rooted,
yeah.
okay.
They're not real particular veins, but they're pretty big ones.
Yeah.
So again, I think if we're going to give her the best bang for the buck here, we're going to get these guys first.
Okay.
And then we'll get those guys later. Sometimes you need to get the bigger feeding veins, but not in this ankle.
Okay. Get the ankles first. Of live questions right now. Lisa wants to know if some people.
The main complications I stated earlier were from the blood in the vein. So you have to make sure that the person doing it is skilled. Has to, the rate limiting step is getting the needle into the vein.
Right.
And some people can have allergic reaction to this. There's other types of docanol. I used to use a lot of treated sodium chloride.
Sure.
That's more painful. It's more likely to get holes in the skin. You can use a lot more of it because it's
Right.
organic. It's sodium chloride.
Right.
So it's a bit of a trade-off, but this is very efficient, this solution, as it works very quickly,
Yeah.
very well. More comfortable with this solution. The other problem is the sodium chloride is not readily available because much of it was made in Puerto Rico. They have an electricity problem.
Right. That's
So
true.
we do almost everybody with this solution now.
Okay.
And nobody.
Now, this could be caused by pressure, right? You mentioned pregnancy could be a cause. You do the procedure. Let's say you get pregnant with twins.
Yeah, again, what I tell is they get cleaned up over 3 sessions.
Right.
And they'll have to come back. I call it a maintenance program, maybe once or twice a year.
Sure. Sure.
Once you get.
Touch-ups.
But you see, these are pretty small, and this is a very painful area. So let's talk about that. The areas that are more painful and the ones that are not so painful are the outer thigh. But if you look here, let's see if we can get in this.
And to the audience, I'm seeing your questions. I'm just going to let the doctor be precise with his work, and I will ask
That's
him.
all right,
what
I can
he needs to-
answer.
You sure? Okay. Lex wants to know, how does this injection approach compare and contrast to a laser approach treatment?
All right, that's a whole. This damages the vein by getting a needle through the skin and into the vein. Okay. The laser damages the vein by penetrating the skin. So it's going to burn as it penetrates the skin, and unfortunately it tends to damage the skin.
Okay, so that's where the burn would come from.
And the other thing is that a laser will only burn one little part of the vein, whereas you saw the sclerotherapy, the huge advantage is it disperses out to all the branches.
Right.
It covers a large area, not just dot, 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 okay? Much more efficient, much less likely to cause skin damage, okay? That's the major problem I see, that it doesn't work and they get skin damage, and then they come to get the sclerotherapy, okay?
Are there any side effects to sclerotherapy?
Well, just the ones I mentioned again, you know. But in general, it is very safe. It's extremely safe.
Okay, great. And then Lisa's asking about the cost.
Well, you know, how do you answer that one? First of all, it's not covered by insurance.
Right.
Second of all, the clinic has certain fees, as every office has certain fees for. So we're going to get this section here. It's a very visible area, and coming up, that type of thing. That's emergency sclerotherapy.
Vacations where you're going to show some legs.
Yep. So you see right away how that disperses out, and you see these are pretty tiny veins.
Wow. So Lisa wants to know, how do you find a reputable doctor to perform this procedure? Because I'm sure different places can perform this procedure, correct? So
well, first of all,
your word of advice?
Many places. So if the honest test rate, and if people ask me if they're standard spider veins, I'm going to tell them it works 98 to 99% of the time. Okay? It's rare that it doesn't work. I'm going to go up to some more big boys here in a minute, so I'm going to wrap this.
All right.
But you can see how small these are. They're very, very tiny. And I do the face and the nose as well. So we'll just.
And Rose, I know your question is, what type of downtime do you have after this treatment? And Dr. Anton, you mentioned there's not really any downtime.
There's no downtime no matter what I do. I don't care if I operate or laser people.
Right.
It doesn't. There is no downtime.
And again, a lot of people are asking, how long does this last?
It's permanent.
Permanent.
You know, what I tell the patients is neither one of us has time to redo things, right?
Sure, sure.
You get it done right, and it'll last. It's permanent. I consider it permanent.
This is a permanent type of procedure. Excellent. And Mindy says, I turned this on just as the doctor was saying something. It could be used instead of compression stockings. What was it? Which I'm guessing is what this is.
Yeah, that's the Coban wrap.
Coban wrap.
Coban.
Coban wrap. Gotcha. All right. And if you guys have any more questions, make sure you leave them in the comment section below. So does this still mean that you have some kind of underlying vein disease?
No.
No.
No, not really. What I'm going to do is I'm going to do this side here for you, and I'm going to have you on your tummy. We'll do the ones in the back. Not quite yet. So I'll get these first. Got a tissue, please? There we go.
And then men also can get varicose veins, correct? Do you see a lot of men patients, male patients?
Men tend to get very large ones.
Really?
That's genetic.
I was just going to ask you, it's going to be your next question. So this is a genetic kind of disease, correct?
So once again, you see how this disperses? You see how immediate this is?
Oh, yeah.
It's, as I like to say, immediate gratification. The other thing I tell the female patients is they can tell their husbands, I know it's not covered under insurance, but sclerotherapy is cheaper than psychotherapy.
That's also true. Now, how do you know if someone's a good candidate for sclerotherapy?
Oh, you just look at the veins.
Just looking at the veins.
She's a good candidate. That's why I brought her back.
Yeah.
I thought it'd be a nice dramatic presentation to see these types of veins.
Sure.
And these are the types you want to inject. They just you could see they respond very quickly. I mean, if you're going to have these veins, you might as well have the cooperative ones, right?
So how do you know if they're not
On
the
your
cooperative
stomach.
veins? How do you know if it's not a good
Well,
vein to treat?
now, if you look at her specifically, she's got a nice cornucopia of veins here.
Yeah.
These bigger ones are going to take longer. They're going to also stain the skin a bit. There's no question, because they're actual
Sure.
structures. So I thought I'd do these first, and then we'll come back, and this will require overnight compression.
Okay.
And then if the veins are bigger, they clot. There's more blood in them. So sometimes you have to aspirate some of the clot a month later.
I
Again,
see.
it's a process.
Sure.
And you have to be comfortable with it, but you also have to know that the veins that you see in all these advertisements, where they show no veins at all,
Right.
that's unrealistic expectation. You want to meet each other's expectations. There is no way you're going to get rid of 100% of the veins.
Right.
It's impossible.
Right.
But to get rid of 80% is a reasonable expectation, and I tell people in general about 98%.
Okay.
Okay?
98%. We'll take that. Wow. Now, is early treatment crucial for something like this?
Well,
Or the
that's always
longer
the
you have 'em
question.
harder?
They come in, why did I wait so long? Well,
Yeah.
you waited long because you didn't know enough about it.
Yeah,
But,
yeah.
in general, it's like anything else. I don't care if it's that or tooth decay. The earlier you get to it, probably the easier it's going to be.
Sure.
And maybe it prevents more veins from occurring later on, right?
Right. Great.
So now I'm going to have you let me just show you what happens with one of these blue ones.
Yeah, let's take a look at those. Those look deeper, too.
This is deeper, and you'll notice, you see how I drew back and there's blood in the syringe?
Yeah. Oh, yeah. There you go.
It gobbles up a lot more solution.
Yeah.
It goes out. It'll close off these veins. Again, it's a different type of vein.
Sure.
So I have to reload again.
Okay.
She's getting a.
Now, I know one
Good.
of our audiences were talking about laser treatment. Are there any other options, procedures that you would do besides sclerotherapy that are out there? Besides laser?
Well,
Or
there's
is that
surgical
kinda
removal,
Surgical?
which is not the barbaric stripping.
Right.
There's laser procedures we do. That's an endovenous ablation, so that's possible.
Okay.
Surgical removal, there are many variations. You can do under local in the office. Most people have that done. There's no downtime from it. They unwrap the leg the next day and shower.
Okay.
Or there are people that get 4-hour procedures as an outpatient hospital procedure. But again, they unwrap the legs the next day, shower, and they're up and they can
Sure.
do whatever they feel like doing.
Sure.
So overall, no matter what I do to people, there's no real downtime.
Okay.
Okay? You want to see any more of this, Sclero?
Well, we can wrap her up, and I'll give you a few more questions. We're almost out of time here, so
Yeah.
it's
Why
up
don't
to
we
you.
just wrap this
Yeah.
up here?
You do
and
your
then-
thing. I'm
and
here to
then,
watch.
we can go over some more information.
Great.
So for this, obviously there are residual veins. There is no way you get rid of all these veins in one session. That's
Right.
impossible.
Okay.
She'll come back in a month. We'll take a look.
We're not just going live, but this is actual procedure. Would you usually do a leg at a time?
No, everything. I do
Everything.
both legs.
Okay.
Right. I don't care if you're a centipede.
Okay. So people
Right.
are, when they're asking
Ankles,
about.
legs, thighs.
Okay.
If they have it on the face and nose, I'll throw that in too.
Oh, okay. Great. All right.
My motto is no vein left behind.
Excellent. Okay, great. Because our audience were asking
tell
about the time you have, correct?
Yeah,
Everybody's
if I
very
think
different.
they shouldn't be injected, I'll tell you.
Okay.
But I haven't met a vein I don't hate.
They haven't tackled. Okay. That's a good thing. Now, do you usually have like a consultation then, go over the legs, the veins, all that stuff? You just have one consultation before the actual procedure?
If they come in and they called and they want sclerotherapy. Now, some people come in and they're not candidates because the
Right.
veins are too big.
Right.
That's a different story. But if it's this type of patient who I can do right away and they're willing to pay for it, then you do it right away.
Sure. Okay. Excellent.
But often the consultations, I think you put through the...
Sure.
Okay.
Now, if you want to kind of tell our viewers where to go, why a medical office versus, I don't know, do they do it at spas or do they go, do
Well, I'm
they
going to
have
tell you
these
the
kind of
best way,
things?
the best way to select is other patient referrals, okay?
Okay.
I mean, that's an honest opinion. Someone's had a good outcome is going to tell you the outcome. It's hard to know from any kind of advertising. I don't care if you're private practice or Cleveland Clinic. How do you really know? I mean,
Right.
everybody loves to advertise, and again, you know, that's not as accurate as talking to someone who's actually, what was the downtime, what was the
Right.
success rate, and what does it cost? All those things, you know, you can chat about.
Right.
On-
Yeah. Not a medical office or not a very reputable place for the price or something like that. What
Well,
could go wrong?
Well, just about anything, but you know, I mean, things can go wrong with us too in
Right.
terms of. But again, the important, you know, I make it affordable, and I try to get it done without extrapolating into 12 procedures.
Mm-hmm.
You know, you know, hopefully you get things done in 2 to 3 visits. Sometimes it's 1 visit.
Right.
Okay,
Right.
not common, but that's what you try to do.
Okay.
And if it's successful, you don't need to advertise. The marketing is automatic.
Word of mouth.
What was the patient experience in the office?
Sure.
Was it difficult to get an appointment? Are the people nice? Are they competent? Do you have good imaging? All these things are important to, you know, and you get a sense of comfort, and you'll know.
Yeah.
It's no different than talking to someone who's going to build your house.
Yeah, absolutely. Absolutely. Well, there you have it. I mean, we are running out of time. Is there anything else you want to tell our viewers before I let you go?
No, I hope this was all helpful.
Mm-hmm.
This is how we do it. And
And she'll be on her feet right as soon as we're done
yeah, she got a lot of stuff to do today.
here. Great.
And tomorrow she can exercise. No restriction at all.
Great.
She can run a marathon tomorrow.
Excellent.
It won't have any impact on the outcome. It's all done. The most important thing is the compression that you get immediately. To wear stockings for 3 weeks, a month, 3 months, it doesn't matter to me,
Yeah.
because you have to get in the vein. You see the results right away. The compression for 24 hours or less is all you need. 12 hours.
Yeah, and just like you're doing, you're wrapping it as you go.
Yeah.
You're not doing
Yeah.
the whole leg and then wrapping
Well, I
it.
did
You're
it
doing
when
it as you go.
the saline. I did it so
Okay.
you'd wrap it, and
I
it
see.
would help it. It compresses the vein right away. And you, okay, if you need more compression here, you need to contour around the ankle. A stocking isn't going to do that. That's
Sure.
why I prefer this here.
Sure.
Plus, it's cheaper for the patient.
Yes. Thank you so much, Dr. Anton. Thank you so much, Nurse Frida. And thank you to the patient for letting us use your legs. Now, if you are local and you're interested, you can call 440-312-1151 for an appointment in Mayfield, Ohio. If you're a West Sider, we have a Westlake location, and that number is 440-250-5760. If you're not local and you just download a free treatment guide, go to clevelandclinic.org/vein. And for more health news information, keep following us on Facebook, Twitter, Snapchat at Cleveland Clinic, one word. Thank you, and we'll see you again next time.